Hello, you guys. I'm Dr. Vidal, and we are back with Tuesday tips. It's so good to see you guys again. I took a week off, so we're gonna combine two of the topics that we were gonna be talking about today, but both are very close related, so it's good to do it in one session. And then I'll answer your questions. September we are focusing on labiaplasty because we have a special, and I'll be talking about that at the end of the live. But today I'm going to be focusing on discussing what is a labiaplasty, what are the areas we can target or improve with a labiaplasty, and the recovery, okay? And then I'll get to answer the questions. So a labiaplasty is a procedure to improve the aesthetics of the external genitalia. There are procedures like a vaginoplasty to improve the canal, the vaginal canal, that can be stretched after pregnancies. But that's a different topic. A labiaplasty is focused on the external genitalia, okay? And for understanding what is the procedure, I have to describe the two main anatomic areas that this procedure targets. So in the external genitalia of the female, we have the labia majora and the labia minora. The labia majora is the one that you see on the outside. It's the hair-bearing portion. It's thicker, and it's what you see from the outside. When the labia majora are spread apart, you can see on the inside a thinner tissue that is called the labia minora. Okay, this diagram, I'm gonna have to explain it because it's not a butterfly. It looks like a butterfly, but it's not. So if you're looking at a person with the legs open, and you're looking at the vaginal canal in the center, we have the labia minora on the inside, right next to the vaginal canal, and we have the labia majora on the outside. What are the common things that people want to improve in these areas? I get a lot question like, how would I know if I need a labiaplasty? If you need or want a labiaplasty, you'll know, because these patients are not comfortable. Why? One can be, the most common one is the labia minora. So this skin can stretch, or genetically, and you were born with this tissue very long, and it extends past your labia majora, and it's literally sticks out. So it's very uncomfortable for them because it kind of, when you're wearing tight clothes, like for the gym, it looks bulky. If you're wearing bathing suits, it may even protrude from the bathing suit. Or even if you're wearing tight clothing and you're moving or exercising, it can pinch, itch. It's very uncomfortable. So if you have this, you're not gonna, the question of how would I know? You know, these patients have been bothered by this for years, most of the time, before knowing that there's a surgery that can improve this. Sometimes after pregnancies, that kind of stretches because everything stretches with pregnancy. And sometimes that tissue is just very redundant after kids. And the other population I see a lot is massive weight loss. The weight, fat increases and stretches all areas of our body, and an area that this can happen is in the labia. Okay, so those are the most common patients that I see, but I see young patients without kids, without changes in weight, that congenitally or they're born with an area that is longer and thicker. Okay, so that's the most common, is the labia minora. So it's this tissue protruding out and causing that. With aging, we see changes in the labia majora that can wrinkle or look deflated, or even long, like kind of bulky. So if that happens, it's usually related to aging and changes in hormonal states that we all women experience on the menopause and postmenopausal period. And that also can be targeted with a labiaplasty. So let's start with the labia majora. What are the options to improve the aesthetics of the labia majora? If it's excess skin, we can trim it, and the incision is really on the inside, so even if you are spreading your legs apart, you can't really see it because the incision is kind of on the inside. You will literally have to kind of open up like a GYN, like you're in the gynecologist, to kind of see it. And because this tissue is kind of wrinkly in nature, the scar tends to heal so nicely that it's very, like, almost impossible to recognize once it's healed, okay? So it's an area that heals very nicely. So you can excise the excess skin, or if it's deflated, wrinkly, you can do fat transfer to the labia majora. So you can combine it with, let's say, a liposuction procedure. Liposuction, you use that fat to kind of enhance and improve the volume of the labia majora so it doesn't look wrinkly and deflated. Okay, those are mainly the two options we have with the labia majora. The labia minora, like I mentioned, is the most common that we do a labiaplasty. And what do we do? Trim it. There are two main procedures that can be done, and it all depends on the anatomy of the excess skin. One is a wedge closure, so it's basically kind of cutting like this, like a wedge, removing that and closing this point to this point, so it kind of removes that excess and creates a better contour with a line hidden in the inside. Or a trim. So if this is elongated completely, and that I would know once I examine you, and basically kind of excising all of that excess skin and removing all of this and closing it like a line. The goal, what is the goal? That the labia minora is hidden on the inside of the labia majora. So when you're standing with your legs kind of a little bit apart, not too much, you can only see the labia majora, but you don't see that excess tissue protruding out. That, like I mentioned, gives a lot of comfort with tight clothing, bathing suits, and of course on sexual interactions, okay? So these are the two procedures that we can do with the labia minora. The most common is the trim, because usually the excess skin is throughout, but there are some patients that the excess is just in the center, and we can do the wedge technique, okay? How is the procedure done? So it's under anesthesia, but we have three options depending on the patient's comfort. So if you want to try to avoid general anesthesia or any IV medication, you could do local only. I don't advise it because we have to put local anesthetic there, and it's a needle, like a dentist, okay? It's a needle and local anesthetic, and that's a sensitive area. So it can be done, but you have to be a person that tolerates pain and that you don't get so anxious, okay? So if that's you and you prefer to avoid anything IV, we could do it, okay? That is an option. The most common one is local sedation. So we put an IV, like a colonoscopy, give you some sedation through the IV medication, and then I put the sedation, the local anesthetic, but because you're a little bit on the loopy side, you don't feel it as much. The recovery is less because you don't have the side effects of the anesthesia, of the general anesthesia, that it's more like nausea or if you're groggy for a longer period of time. Or for patients that are a little bit more anxious and really, I just want to be knocked out, I don't want to feel anything, general anesthesia is an option, okay? So depends on you and your level of comfort, but the procedure can be done throughout all of these options. And one of the most common ways I do it is combined with another procedure, okay? So majority of my labiaplasties is patients that are coming for example, mommy makeover, breast is the two procedures that I most commonly combine it with the labiaplasty, and we do the labiaplasty combined. So the special is, if you're doing a procedure with us and you're booking this month, you can add the labiaplasty, and it's 15% off of the labiaplasty cost, okay? Restrictions apply, but give us a call if you're interested in knowing a little bit more about this, and our coordinators can tell you more, okay? So, like I mentioned, this is the most common way. I don't like to combine it with liposuction procedures. Why? With liposuction procedures, you're going to be wearing a faja, and the faja is going to be tight in that inguinal area. I don't want anything tight because it may spread the area and cause wound dehiscence or wound openings, okay? So that's why I don't like to combine it with liposuction procedures. But mommy makeover, breast procedures, brachioplasty, for example, other procedures we can combine with labiaplasty, okay? And the recovery. So basically, when you wake up, you're gonna have like a big diaper underwear. That big diaper is really for the first 1 to 2 days because you may see some spotting, some bleeding after the procedure for the first 48 to 72 hours. After that, The recovery, those 2 to 3 days is the area that's going to be a little bit more uncomfortable. Okay, the time period that's going to be a little bit more uncomfortable. After that, usually people are okay with just Tylenol. You're going to ask you to apply ice and do sitz baths. So what's a sitz bath? You put it like a little pile of water and sit on that so you can clean the area without applying any pressure to it. If you had a vaginal delivery and you had sutures done, it's very similar to the post-op care that they instruct you after a vaginal delivery. So kind of clean, but without rubbing, pad dry it, and then you're gonna put in a biotic ointment, and that's for the first 2 weeks. After 2 weeks, the majority of the swelling and discomfort is gone, so the majority of patients are back to work, are usually in their normal routine. The only thing up to 6 weeks is no exercising and no intercourse, okay? We have to wait until those sutures heal well to start applying tension and pressure, okay? So the majority of the recovery is gone at 2 weeks, but there's 2 things, exercise and sexual intercourse, that is up to 6 weeks. After 6 weeks, you're good to go, okay? So I'll take some questions now if you guys have it.
Yes. Hello, Dr. V. Do you recommend having this done with an abdominal surgery? So, tummy tuck?
Yeah, very common. I do it with a mommy makeover or a tummy tuck, and it can be safely combined because with a tummy tuck, you're going to have drains there. You're going to be wearing a binder for the first 3 to 4 weeks. So by the time that you switch to a faja, that pressure is okay in that area because everything is going to be well healed.
Okay. How many days did you say at first, referring to the recovery time for the labiaplasty?
So these 2 numbers that you see here, 2 weeks is the majority of the swelling, pain, discomfort is gone. So if you have to take off of work or need help around in the house, is for the first 2 weeks. After 2 weeks, you're going to be able to do majority of things. Only 2 restrictions are exercising, heavy lifting, more than 10 pounds, and no sexual intercourse, and that's for 6 weeks.
Okay. En español, doctora Vidal, me quiero hacer un BBL, no sé, cambio de fajas y la silla del BBL.
Okay, so para el BBL vas a tener la faja inicial, yo te la voy a dar, ¿ok? Esa es la que llamamos el estadio 1. Es una faja que parece igual que el estadio 2, pero es un poquito más loose o más
suelta.
Más suelta. Así que esa yo te la voy a dar y es la que vas a utilizar por la primera semana. Luego de la primera semana, entonces es que cambias al estadio 2, pero es hasta que yo te diga cuando te veas la cita de seguimiento. Ese estadio 2 la vas a estar utilizando por 6 semanas, ¿ok? Todo el tiempo. Y después de 6 semanas a 3 meses por 12 horas al día. Y el pillow o la almohada del BBL la vas a empezar a utilizar a las 2 semanas. Las primeras 2 semanas la puedes utilizar si necesitas sentarte por unos momentos, pero no tan constante. Trata de no utilizarla todo el tiempo hasta las 2 semanas. A las 2 semanas la mayoría de los pacientes regresan al trabajo, así que puedes utilizar la almohada hasta las 6 semanas. Ya a las 6 semanas te puedes sentar.
Thank you. Yes. Do stitches dissolve or have to be removed?
Good question. The stitches that I put in labiaplasty are all dissolvable, so no stitch removal.
Okay. Wait. Okay. Is there any discomfort at peeing?
Oh, you may experience some burning when you urinate, and that's because when you urinate, it may touch the incision. So that's why the sitz baths are so important. So it may burn a little bit, but it's not gonna be too painful. And then you're gonna sit bath so you can clean the incision so you don't have any urine residue in the incision, and then apply the antibiotic ointment.
Okay. Is there any age limit to do this procedure?
So I have an age limit in general for general anesthesia, and that is 60. So it depends on your medical conditions and on what procedures are you combining. I may do it up to 65. Remember that I operate in an ambulatory facility, office-based facility, that's the term here in Florida. So I have to have an age limit just because of the anesthesia part. But send us a formulary, I evaluate your case, and I can let you know.
Y en español nuevamente, el promoción, por favor, la promoción.
La promoción que tenemos este mes de Labiaplastia es que si haces reserva de una cirugía y vas a añadir la labiaplastia, vas a tener un 15% de descuento en ese add-on, en esa añadidura del procedimiento de la labiaplastia, en ese otro procedimiento que vas a tener. Mayormente es el Mommy Makeover o procedimientos de seno o el Tummy Tuck, ¿ok? Si te interesa, simplemente nos da una llamada, nos comunicas con la coordinadora a través de Clara y nosotros te damos toda esa información. Ok. Willy por poco tumba el televisor, pero nada, muchísimas gracias por haber conectado. Thank you so much for all the questions, for getting in the live, and I'll see you guys next week on Tuesday Tips. Take care.